I'm Andrew Mellin, Vice President of Medical Informatics at Surescripts, and it's great to be here today in the Interoperability Showcase. I'm really excited to talk about how the Surescripts Network Alliance, our partners and the health technology vendors, the pharmacy benefit managers, pharmacies all came together to solve a really important problem facing healthcare today around medication pricing for patients. So I think intuitively we all understand this problem. We know that medication costs have been expensive, and we all understand from personal experiences challenges when we get surprised at the pharmacy. In fact, when we talked to physicians before this was available, 78% of them told us that they thought it was very important to understand the patient's out-of-pocket cost at the point of care. Yet 87% of them said it was really very difficult to have that knowledge. So it's a big problem. And why is that important? Well, in healthcare, there's been many studies that have shown that the drug cost is directly correlated with medication adherence. One interesting study showed that medication abandonment was about 3.3% normally, but when a drug cost was $40 to $50, that abandonment rate went up 3.4 times, so very high. And once you got over $50, 4.7 times. So this is all about medication adherence, in addition to getting something that's economically right for you. So the Network Alliance, our partners came together with us to help solve this problem, and we focused on really three core things. First of all is accuracy. Trust is really important with providers, so making sure that the information presented to the provider was precise and accurate, and the patient wouldn't be surprised at the pharmacy. The second thing is around giving alternatives. So making sure not only do you see a price, but you understand, the provider and the patient understand what are the alternatives, whether it's an alternative therapeutic equivalent, whether it's a different way to get the drug through mail order, or so forth. And also it's about how do you understand if that drug needs a prior authorization. The third part of this is around getting in the physician's workflow and thought through. And I think this is the part I'm the most excited about as a physician. All of our partners have worked really hard to make sure that it's not just another alert that pops up or a bunch of other buttons the provider clicks or somewhere they go outside the application. But it's demonstrated right, it's presented right in that physician's process of making their decision. So that's where we see making a difference. And we've seen great results. Over in the month of December alone, we've seen 6 million transactions where this was presented to the provider. We know that over 100,000 providers have access to this today. But more importantly, we've seen the impact on the patient level. For example, at psychiatry, when psychiatrists make a switch, they save an average of $288 per switch. That's a lot of money for each patient. For even primary care doctors like myself, they're saving $50 to $60 every time they make a switch. So an impactful transition. And we see very dramatic stories where one patient saved over $8,000 by simply understanding a different way to get that same medicine the doctor prescribed. So this is something every provider I've talked to is excited about, something we're seeing really meaningful results. And we'll spend the next amount of time hearing some stories from my colleagues here, and then we'll save about 10 minutes at the end for Q&A. So I'm now going to ask each of my colleagues to introduce themselves, tell us a little about yourself and your organization, and more importantly, just help us understand from your perspective what price transparency means and why is it important that we're acting on it now.
Well, sure. Good afternoon. I'm Dr. Lynne Nowak. I lead our provider engagement solutions for Express Scripts. And Express Scripts is both a pharmacy benefit manager as well as we run a home delivery pharmacy and a specialty pharmacy, Accredo. I'm an internal medicine physician myself, so I've been in the shoes of our providers who are trying to help their patients make good decisions. And I think, looking at it through the eyes of a physician, I think, one of the most important things that this is helping us solve for is really helping make those better informed decisions. And whether it's the physician making a more informed decision because they've got real-time data that can help them really understand the cost differential from different drug choices, or having that informed conversation with their patient that's in front of them to give them the price that that patient is going to have to pay out of pocket. And if they can't afford that, they can then have an informed discussion about what other options might be, because they have the patient leave not knowing if they're going to be able to afford the medication. There's a really high risk, as we know, of them just abandoning that script. So really, I'd say this is about more informed and better accurate decisions for the patients.
Great, thank you. Sherling?
Hi, my name is Michael Sherling. I'm the Chief Medical Strategy Officer for Modernizing Medicine. Modernizing Medicine is a healthcare information technology company whose mission is to improve practice efficiency and patient outcomes. And so price transparency is very near and dear to our mission as well. Our products and services include electronic health records, practice management. We serve specialty physicians in dermatology, ophthalmology, orthopedics, gastroenterology, and ENT. So what does price transparency mean? Well, it means patients only take the medications they can afford. And in medical school, we're always taught about mechanism of action of the drug, how effective it is, but never, can my patient afford it? What's the cost? And that's really been this mystery up until almost 2 years ago or so. And with these healthcare asymmetries, we really need to understand that for the end users of healthcare, which are the patient and the doctor. And that is where the decision is made. It's made in the exam room at the point of care. And being able to integrate price transparency for the doctor and the patient when they make that decision means doctors can make the effective choice at an affordable cost.
Thank you. How about Jill?
I'm Jill Helm. I work in the Clinical Workflow Solutions Group at Allscripts. We're an EMR vendor representing about a little over 180,000 physicians across the country. And what price transparency means to us is having that information that has historically been available at the pharmacy counter and moving that upstream into the clinical workflow where the prescribing decision is made. And so not only information about cost, but also actionable information about what the prescriber and the patient can do to change that cost, whether that be going through a different delivery channel, such as home delivery, whether that be prior authorization, therapeutic alternatives. It's having that information available to the physician while they're prescribing. It really enables the physician to touch that patient once and to get the prescription correct and avoid those phone calls and faxes from the pharmacies on the back end.
Thank you. Josh?
Hi, everyone. I'm Josh Holzbauer. I'm the Director of Physician Wellbeing for Epic. We're a software vendor in Wisconsin, and we make healthcare software for organizations all around the world. And I just echo the sentiments of my fellow panelists thus far. I think we've talked a bit about transparency and how it helps the patients. But in addition to that, I think it can be really empowering for the physicians themselves. When you read through some of the burnout literature that's available, one of the things that really stands out is comments like, I feel like a cog in a wheel. I feel like I'm part of a big machine, and I don't know exactly how I fit into that. I feel like I'm not in control of my environment. And I think this is one example of how you can start to give the physicians that control of how they can have that information that's been a black box to them for as long as they've been practicing, and put it in their workflow when they're with their patient so they can have more effective conversations with their patients. And as we've continued to expand the software that we release, we now have a social care module. And one of the things that really stood out to us over the past few years is that, I'm sure you've all read the similar study that's out there, that clinical care is just one piece of the puzzle when it comes to a patient's overall health, and financial health is also a big part of that. So the physician's ability to be sensitive to that when they're prescribing the medications, when they have the patients in that precious time in the exam room, I think will be very valuable for both of them.
Great. Thank you. Thank you all. So Dr. Nowak, let me ask you a question. You were an early partner of ours in developing this real-time prescription benefit tool. So what is the crux? What's at the crux of this challenge that we're trying to solve together?
Yeah, well, I think we've all touched on it. It is about having a more effective engagement at the point of care. And when you think about the whole physician experience or patient experience when you're in a clinician's office, there are often a lot of unknowns. Patients are nervous, there's a lot of anxiety. The doctor's trying to make the best decision, typically as quickly as possible, because they're trying to get through their day and take effective care of as many patients as possible. So being able to get that information, that actionable information, the word that was used earlier, in front of the physician in real time at the point of care to really help make that best decision that's going to be clinically effective, which is what all of us went to medical school to try to do, but also engage the patient in a way that makes sense for them from an affordability perspective as well, to ensure, and you mentioned earlier, the adherence, that there's so many factors that can affect a patient's adherence, and we want to at least eliminate that unknown cost as a variable for that. So getting that accurate information in front of the doctor at the point of care when that decision is being made, as far upstream as possible, and not waiting till they get to the pharmacy counter to get a surprise, is really critical. And I think that's where really having it in the workflow in real time makes such a huge difference.
Yeah, that's great. No one likes a surprise at the pharmacy, whether it's for your patients or us personally. I think that's happened probably to many of us. Dr. Sherling, you're in this unique position. You are developing software, but you're also the voice of a practicing physician. You use your software every day, or many days, I should say, and really understand sort of how important it is that you can't just keep throwing more things at the doctor, but you have to present information in the right way that's part of their workflow, part of their decision process, and really makes it easy for them to do the right thing. So can you talk a little about how you think about that?
Absolutely. So the teams at Surescripts and Modernizing Medicine have really worked hard to make sure that we're only showing the doctors and the patients what they need to see, when they need to see it. That means when a patient's checking into my office, they can go ahead and reference the medications that they're already taking through the RX fill module. That means the doctors, when they look at that, can see what the patient's filled based on what they've prescribed. So before I even walk into the exam room, I know whether my patient is adherent to the medication therapy or not. And now when I'm diagnosing my patient or treating them, and I'm deciding to prescribe something, before price transparency, it was a very inefficient trial and error kind of experience. I'd prescribe something what I thought was effective, and then 2 weeks later, I'd get a call from the pharmacy or the patient saying that medication was $400, or worse, $10,000, because we have biologics that cost thousands of dollars. But the worst thing is before this technology, patients may not even speak up because they feel ashamed that they can't afford something. And what happens is they don't even take it at all. And then at the follow-up appointment, I learned this 6 months later. And so what we've achieved through our users is the ability at the point of care to show them the effective medication and what it costs, and if that's too expensive, to show them alternative medications that are equally effective. And that's been efficient for the practice, efficient for the patient, and they get the treatment that they need, which results in fewer visits to the office, lower hospitalization rates, and that's what we're all here for.
Excellent, thank you. And Jill, you've been our partner as we've rolled this out to Allscripts EHR users. And I know you've talked to many physicians using this, and just give us a sense of how's this changed the way the providers have said that they interact with their patients?
Yeah, absolutely. This has been received very positively by our physicians. We did a recent survey with our group of users that are using the price transparency, and we found that 93% of our physicians reported that their patients had actually saved money by being able to utilize the information within price transparency. Yeah. And that's good for the physician as well as the pharmacy. But even more than that, actually over 50% of the physicians felt that it saved them time because they weren't getting those phone calls, they weren't getting those faxes after the patient had already left. And over 85% of the providers reported an increase in overall patient satisfaction. So I think better adherence, more satisfied patients, and a better healthcare experience, to me, is a win-win all around. Historically, physicians to some degree have had pricing information. I've had an opportunity to go to some of our customers and seen sticky notes on the side of the computer right? Everybody knows who has the $2 generics, right? Who has the zero-cost prescriptions. That's now bringing this information in to the EHR application in real time. So our physicians have been very, very pleased with this, and we're looking forward to expanding it even more.
That's great. You know, something you said there, Jill, you said time. 50% of doctors said this is saving them time. And
Absolutely.
I was at a talk with Amdis yesterday. They gave one of their sessions was about physician burnout.
Yeah.
And time is really one of the biggest or most precious thing that a provider has. And we talked about that yesterday. That anything to give the doctor back time. And so that leads me to you, Josh. You know, you have a really intriguing title. I love it. Director of Physician Wellbeing. You know, burnout is a huge topic. I hear it from my CMO, CMIO colleagues all the time. And so how do you see price transparency tools improving physician well-being? You know, what are the keys to making this not just one more thing that's put on them, one more thing that they have to manage when they're seeing their patients?
Yeah, and so great question. And I hinted at this earlier. I think that when it's deployed properly, this really can empower the physicians to make the right decisions at the right time. And I think that can make all the difference in the world. When you get that patient gratitude, when the patient, someone had mentioned earlier that a lot of times the patients are embarrassed to say, I can't afford this medication. And instead of that medication staying at the pharmacy where they don't pick it up, instead, if the physician can actually suggest and say, you know what, it looks like this medication is going to be a little bit more cost effective for you. Maybe we'll try that. I think when you shadow physicians, as I do across the country, you can see that gratitude from the patients that you understand me. We're making a connection here. And I think that's why physicians got into practicing medicine in the first place. And when it comes to being delicate about the right time in the right place, because we don't want it to be another thing. I think that's a great point. One of the things that we've tried to do, and I know the other vendors have done it as well, and we've partnered with Surescripts and other folks on this, is to try to only show an alert, for instance, when there are cheaper alternatives. You don't want to show it when they're the same price or something like that. So limiting the use cases for when you show it, and then also providing an on-demand way, maybe even before the visit happens, where you can click and start to look at some of your options and be prepared for when the patient is in the room. And some really good feedback I got on this was from a physician at WellSpan. And what he said was, this is the one alert I want to see more of. I want to see more of these so that I can help my patients save money and take better care of them overall. And I think that's good for the wellness of the physicians and of course, for the patients too.
That's great.
Yeah.
And, you know, go ahead.
Yeah, I'll just kind of, not to pile on, but I think when we speak with our physicians and we bring docs in to really gauge their experience, and we go out and meet with physicians as well, and very similar feedback. I think one of the other things when it comes to time, certainly prior authorizations, you know, a real challenge for physicians. So being able to also, within the real-time prescription benefits, show the formulary coverage and whether or not a prior authorization is required is really critical, because, you know, when a physician can see that a drug requires a PA, but there may be alternatives that do not require a prior authorization, that alone can save them that time. Or if they make that switch, or even just knowing that a prior authorization is required, they can go ahead and initiate the process to do that and not wait for that reaction when, again, the patient gets to the pharmacy and gets a surprise with a prior authorization. So they know it's there, they know it's required, they can start that process. And you know, one just sort of an alternative perspective on the pricing. We've had a lot of debate internally at Express Scripts around what to show as far as alternatives, and do we show alternatives that may be higher cost? And and we really were going down the road of, no, we only want to show lower cost medications. Why in the world would you ever show a drug that is a higher cost? And physicians have actually given us feedback that they like seeing the ones, even if an alternative, even if it has a higher cost, because that either confirms that they've already chosen the lowest cost alternative, or they can show their patient. A lot of times they use this as a tool for that engagement and that discussion with the patient to be able to say, okay, I chose this one. Maybe they saw an ad on TV for a different one, so that's, you know, a conversation we have all the time in the office. And they say, no, I chose this one. The one that you saw during the Super Bowl costs this much more. this is why we're not using that one, and it really, helps having, again, that informed discussion. Even if they've chosen the lower cost one, it helps reinforce to the patient that's really the best choice, that a different one would even cost them more. So,
and I think that's a great example of cases where the EHR in the exam room absolutely does not have to be a burden, and it doesn't have to be something you have to do. In some cases, when it's used right, it's something that you get to do. And instead of the physician looking at the screen while the patient's looking at the physician, you turn the monitor around and you look at it together and you discuss, this is why I'm choosing this option. You can see right here, it's a little bit cheaper. I love the example of the Super Bowl commercial. There were a lot of good ones this year. But yeah, I think, and we like to see that in a number of different ways. But certainly when it comes to cost transparency, it's very near and dear to the patients. It's a great opportunity for them to interact with the EHR together.
Yeah, we have an iPad device, and so typically on the iPad, I can just show my patient as I'm prescribing, and because we're specialty specific, we'll have the drug of choice and all the alternatives, and they can just see it as I touch it. Here's the price. This one's $100. This one's $300. It just brings the patient into the conversation, and instead of getting that phone call a week later, we can just decide then and there what we want to do.
Yeah. It's great. I mean, shared decision making is something that we're all trying to think about as physicians. It's not the physician dictating what you should do anymore, but it's really getting the patient to be a part of it. And so, Dr. Nowak, let me ask you, you've had the opportunity to talk to physicians and other stakeholders, you just mentioned that, about the impact of cost on medication non-adherence. From your experience, what do you think are the most important aspects of these kinds of tools to optimize? Really what I see are three important things. One is the clinical intent, what the provider wants to do. One is what the benefit plan sort of showing as the various options. And most importantly, that shared decision-making process. Being able to, it's not either or always, it's not always the cheapest, but it's the best choice for that patient. So, as you talk to people, how do you think about optimizing those three aspects of this tool?
Yeah, I think one of the most important things is that the real-time prescription benefits through Surescripts enables that connection directly to that patient-specific benefit. So there are lots of pricing tools out there that'll sort of give a ballpark range or can kind of give an idea, but using it embedded and engaged in the electronic medical record with that direct Surescripts connection gives a patient-specific price for that patient at that point in time, inclusive of where they are in their benefit. Mm-hmm. So you can see this is what the patient is going to be expected to pay at the pharmacy today. And so having that accuracy, I think, is really important. And then the other thing, I think, is that availability of the therapeutic alternatives. So you cannot just see the price, but it's in the context of other medications that may be options for that patient. Again, whether it's more expensive or less expensive, the doctor and the patient can then together make an informed choice. And then what I touched on earlier is the ability to see the coverage within that patient's individual plan. So whether it's on formulary, off formulary, requires a prior authorization, doesn't require a PA, having all of that information together in one place, in one tool, in their workflow, is an incredible wealth of information in a split second. Is it covered or not? Does it require a PA or not? What's the cost? And if I don't like the cost on that one, what are my options? Right there in one spot.
Right. And I think you mentioned something that resonates with me. As a physician, for all of us, we were trained to be really skeptical about information that's presented to us. And once you lose our trust, once something's presented and the patient goes to the pharmacy and says, you said it was $10, was really $100, your trust in this information is wrong. You lose that trust. So I think that's really important is being able to make sure it is it's not a guess, it's not an estimate, but it's a precise price that individual person, based on their plan, based on where they are in the year, is going to have to pay out of pocket at the pharmacy. So, thank you. Josh, one of the other topics that we've mentioned a little bit, but that's very important, is medication adherence. And medication adherence is complex. There's not fulfilling the drug, there's staying on the drug, there's socio-demographic factors that play a role, many different things. And I think this tool does play a role in it, and I think also plays a role in conjunction with something you mentioned, with prior authorization. And for example, we've seen 28% of physicians who are presented with a drug that requires a PA, but there's an alternative that doesn't. 28% of the time they switch, and that eliminates that whole both burden for the provider and the potential for them having to wait for that PA to be completed. But even if a PA is required, this tool allows this interoperability, this network gives them the option to start that immediately and hopefully finish it by the time they've left the office. So it's not just one piece. There's many pieces of this puzzle for medication adherence. So as you think about this at Epic with your medication adherence strategy, how do all these pieces fit together?
Sure, and I think you had mentioned the statistic earlier that there's a direct correlation between the cost of the medications and the adherence, as you can imagine. So we really see them, price transparency and medication adherence as being really one and the same, or at least feeding into the same system. And so what we do with med adherence is working with outside groups like some of the lovely groups on stage to pull back information from the pharmacies and the PBMs on whether patients are getting those, are they picking up those scripts, or are they going and not picking them up. And what it ends up doing a lot of times, I got a few examples of these, it was hard for me to just pick one, but it's impacting the actual conversation in the exam rooms about which meds a patient is taking versus not taking. So one case was, there was a patient who presented and the medical assistant brought them into the room and asked them all the questions. Are you still taking these medications? Are you still taking the metformin and the simvastatin, et cetera? And the patient said, yeah, I think so. Kept going. The physician came into the room and the physician asked the same questions. Are you still taking these meds? And the patient said, yeah, I'm taking them. But now that there's an adherence score that actually tells you, it's color-coded so you can really catch it just with a glimpse from the corner of your eye, you can see green, red, or yellow. That tells you, well, there might be more to this story. They might not actually be getting this medication. So in the specific example, it was the metformin where it was red. And the physician said, oh, wait a second, you said you were taking the metformin, but my information here says maybe you haven't been able to pick up those prescriptions. So can you tell me a little bit more about that? And of course, it jogs the patient's memory. And the patient said, oh, that's the med that gave me diarrhea. I stopped taking it months ago. You're right, I haven't been taking that. And then you have a new conversation and say, okay, let's work on something else. Let's find an alternative that works for you. So sometimes, obviously, cost is a big part of it, but there's all kinds of other reasons the patients might not be taking meds. And so when you bring that into really into the exam room, as we had mentioned before, in the workflow, once again, you can have a more meaningful exchange between the patient and the physician, and you can really provide better care. And that, as I had mentioned before, I think creates a better relationship between the physicians and the patients they take care of.
Yeah, and I think what you just talked about is an example of what you mentioned, Dr. Sherling, with this information asymmetry, right? And before this network had come together, the doctor would never know. People always overestimate how much their medications are taking or simply forget. And I think what this alliance has done with all these different stakeholders help close that gap, eliminate a lot of that information asymmetry. So better decisions are made, and we're doing the right things for our patients. So, Dr. Sherling, another question for you. You still see patients, and I think for me as a physician, one of the things that's been amazing for the past 10 to 15 years is a lot of these diseases we learned about in medical school, the way you treat them have been turned upside down. There have been amazing advances in drugs, these biologic drugs that take diseases that were incredibly challenging to treat before and dramatically change people's lives. But they come at a cost. They're expensive because they're targeted at small subgroups of patients often. So, how do you think about this? Dermatology is a good example where a lot of these biologics are used for difficult to treat diseases. They may be less expensive alternatives, but maybe not as effective. So how do you have these conversations with your patients?
It's a great question. So biologic therapy is something that patients typically take for the rest of their lives to control their disease, whether it's psoriasis or atopic dermatitis. These are great treatments, but they are very expensive. And there isn't a correlation between what the insurance is and how much you're giving with what the price is. And so we don't know this information. These medications cost between $30,000 and $50,000 a year. And so with this new system in the workflow, we can see whether a prior auth is required, as well as what the patient will have to pay out of pocket. And that ranges anywhere from nothing to thousands of dollars, things that my patients can never afford. And now when we have that conversation, it's not just here's the treatment, here's the side effects, but also here's the treatment, here's the side effects, and here's what your out-of-pocket expense is going to be. But it's not just biologics. In dermatology in general, even generic medications are hundreds of dollars. And this has really been a change over the last 5 to 10 years from when I was in training. And you would think that only brand medications are expensive. Sometimes the brand medication's cheaper than the generic. And you just don't know until you kind of price it out. And so whether it's an acne medication, an antibiotic that they're taking every month, or it's a topical medication for a rash, we can really reduce those costs from hundreds of dollars a month to $20 or $30 a month. And it's a conversation that I have every single time I prescribe something. And dermatology is just more hit than some of the other specialties because of the unique dynamics of the marketplace.
And just to add there, even in the cases where those medications are very expensive and the patient's out-of-pocket cost is very high, then there's an opportunity for the physician to get involved as well, looking at other ways to potentially reduce that cost, patient affordability programs, charitable foundations, others. But you have that opportunity with the patient there to have those discussions about those alternative payment mechanisms that you really can't have if the patient is at the pharmacy. We have physicians. I was recently visiting one of our physician practices in Ohio where a physician in urgent care had to spend over a half an hour on the phone with a just waiting to get the community pharmacist on the phone to have a conversation about the prescription. So it's that type of time right now that I consider to be wasted time out of the physician's day, that price transparency has changed all of that because the information is presented within the workflow to the practitioner without any added clicks. It's just there for them to look at, right? And so they can start to see some of those big gaps in prices and really improve the efficiency of the practice of medicine, as well as create more satisfied patients and speed to therapy.
Yeah, I think that's a great story, and something that I've strived for over my career is how do you eliminate rework, right? How do you get to do things right the first time? And that's a real challenge. I mean, what I see is provider offices hiring more staff because they're spending more time on rework and redo. And I think whether it's price transparency, just like that story you just told, helping not have to do prior authorizations or rework after a decision's been made, really plays a role in improving these offices' efficiency, helping with the provider burnout, and just improving the experience of patients. So, Dr. Nowak, I know you've seen some results already with this, right? You've had a chance to see what the impact is. Could you share some of that with the audience?
Sure. Well, we've touched on a few of them. We talked, again, if you think about the different capabilities that real-time prescription benefits bring to the physician and the behavior that it's trying to drive, the great news is we're seeing that behavior. So, you mentioned 28% of physicians will make a change or there's a 28% change rate when the doctor sees that they've ordered a drug that requires a prior authorization and there's a drug that doesn't require a PA available. So they are switching to that non-prior auth drug. The other thing we haven't really mentioned here is that in addition to the alternatives, real-time price transparency shows the cost of that medication for a 30-day supply at retail, a 30-day supply at mail, and a 90-day supply at mail. So the switch from a retail to a mail, if that's an option, or the switch from a 30-day to a 90-day prescription is also helping drive adherence, helping drive cost savings, and we're seeing that pan out. The doctors are making those changes from a shorter day supply to a longer day supply, particularly if it's a maintenance medication, of course, or if that patient has a mail benefit, they are absolutely making the switch to mail where that is more affordable as well.
And that's something that we've heard too with regard to the mail order pharmacies, is that a lot of physicians are saying, I just didn't know.
They had no
wow,
idea. Yeah.
This is so much cheaper. And for folks who, so my parents are snowbirds. I'm from Wisconsin. So every winter they pack it on down and they move to Texas and they use the mail order pharmacy for that. And so sometimes it can be more convenient for the patients, but that has been a very pleasant surprise for a lot of clinicians.
Yeah, and the example I gave where a patient saved $8,032 precisely, that was simply, it's the same drug, but going from a retail pickup for a specialty infectious disease drug to getting it through mail order. So no change to the provider, probably easier for the patient. You know, and often we see with the 90-day dispensing of it, it's more economical and you see better adherence because there's less fill to worry about. So it's a benefit to everybody. So we'll do one last question for everyone, then open it up to questions from the audience. You know, so for organizations that aren't using these tools yet, you know, for the ones that are still considering this, what's the one piece of advice you give, either to the leaders, either as they evaluate the tools and are thinking about where to put this in the priority, or as they're trying to convince their peers about the importance of this in medication adherence, physician burnout, all the things we've talked about today. So I'll start with you, Dr. Nowak.
Yeah, just quickly, I would have them do a demo to see how truly easy it is. I think there's a lot of skepticism from providers, just in general, that there's a new tool that's going to help them. We've heard that before. This one really does. And I think just when they see a demo, when they see it truly coming in their workflow, you know, to see how simple it really is and how valuable the information is just in that split second, I think just really seeing it in action and seeing the valuable information that it provides, your providers will absolutely get on board and not only agree to it, but demand it.
The number one cause of burnout in dermatology is actually prior authorization. It's the back and forth of my practice and spending hours trying to figure out whether something's covered or not, rather than treating patients. And so this is an easy message to our customers, having the electronic health record with a partnership through Surescripts, figure out what the cost of things are and whether something requires a prior auth or not. As value-based healthcare becomes more and more entrenched in how physicians get reimbursed, I could see how, you know, just like today, we get measured on whether we should order a test or not, or whether we should do a procedure or not. You know, what we prescribe is also going to have an impact as well. And so the difference between price transparency with a medication and a procedure is that I'm still fighting with the insurance company because I don't know, and they don't know what the elements are for the best procedure. Whereas here, I can have that conversation ahead of time, which saves me and my patients time. This is really a no-brainer for patients, for physicians, and for electronic health vendors as well.
Great, thank you. Jill?
Sure. So for those skeptics that are out there, I would share that price transparency is real. It is truly, it's one of those features that is really available in the EHRs today. There's many health plans that are already sharing price transparency information and more that are starting to share that information every day, that the information is actionable and that it's accurate and that it can really save the physician and the physician's practice time and money.
Yeah, and for me, so my background is not clinical like a lot of folks up here, but my background is project management. So whenever I'm managing a project, the first thing I worry about is expectations. So you want to set the expectations appropriately. I would let folks know, and I've had conversations with some of our customers who are going to take the leap and use this feature, is that it's not going to be perfect. There is some noise in the data. So a couple things you can do about that is check your PBM coverage ahead of time to get a pretty good idea of which pharmacies are going to be sending you information. So you're prepared for that and you can share that message. And I think I would fully grant that this is still, it's a relatively new technology. There's more positive feedback than negative, but like I said, there's a little bit of noise in the data, and I think collectively the industry knows that we need to improve that, and it is an area that we're working on. You can absolutely check with your HR vendor if you have feedback about this. We want to hear it. We want to talk to the other folks in the industry that are working on this. But yes, on the whole, the feedback has been more positive than negative, but that doesn't mean that you're going to have absolutely perfect data and it's going to work in every case. I think one example of this is just one I heard last week, which is we talked about the mail order pharmacies and how the 90-day supply can be cheaper, and that's definitely true. But on the flip side, it was actually a dermatologist who said, that's true, but I just need a 7-day course of antibiotics, or a 10-day course. So 90 days, yeah, that might be cheaper, but maybe it's not practical. So we're working through some of those things. We want feedback. We want to make it better, and we wish everyone luck going forward with this.
Yeah, I think the important issue for that is that it's there. The information's there. So and that's why, whether it's a more expensive or a less expensive drug, whether mail may or may not be the most cost effective. In some cases, the retail cost may be less than mail, and that's okay, but the doctor can see it. And so really having the information there and having it accurate is really where the value is.
That's great. And I think that this is something that patients will be demanding, right? We see at the health systems where they have patient experience officers that this stuff becomes part of their strategy. It's not just about the physician, but ultimately about the patient. So with that, first I want to thank my panelists, and we have about 10 minutes for questions. So we have a microphone here if anyone would like to come up and ask a question to the group. Don't be shy.
Hi, I'll ask a question. First of all, thank you very much. There were obviously lots of good things that came from this discussion from the perspective that we're talking about consumerism, decreasing physician burnout, as well as leading to value-based healthcare. Those are all really great things we heard about this morning. To see them come together in this area is awesome as well. When talking about all of the data points that can be made available to a physician at the point of care, that I think to myself, there's probably a fine line between helping and the burnout question. So I'm interested to know what your thoughts are in that regard. Where do we pull the plug on more data being helpful versus less being what we want? So I'll just let you guys answer that.
Want me to take? I'll take a shot at that one. So I think a really great example of that is something we've had a lot of discussions about. I know we at Express Scripts have talked about this internally. We've had a lot of conversations with Surescripts, and that's about showing plan cost. So the cost to the payer. We've talked a lot about value-based care as providers are in more integrated arrangements where they're being in pay for performance or value-based care arrangements. They want to know the plan cost. Our payer customers are certainly interested in getting that plan cost in front of the physicians. And that's one of those where how much is too much. And we're already showing the drug that the physician chose, 3 alternatives, a 30-day retail, 90-day retail. I said 90-day at home. Or it's 30-day retail, 90-day at home delivery, and 90-day at mail. And there's already 12 numbers on there. So to then show the payer costs for all of those, what does that look like? And then how do you even define that, right? In the pharmacy world, we all know payer cost. It's a very muddy situation very quickly. So that's, I think, just one example of where we've kind of said, okay, let's get this out there first. Let's start here and get the physician's response. Do they like 3 alternatives? Do they like 5 alternatives? Is it too much? Do they like only lower cost drugs, or do they like lower cost and higher cost drugs? So I think it's really about getting that physician feedback and what's going to work, and we're going to have to toggle up and down with more or less information as we see what's effective and as we get that feedback from the providers. But I think we all just agreed we needed to start somewhere and get this information starting with the patient first, keeping the patient at the center. I think we all agree patient cost is a priority, and then go from there as we learn effectiveness.
And I would just say, as a physician user, don't make me click, don't give me a pop-up, don't give me an alert, don't make me scroll. And if you can do all of those things and just do it in the workflow, I will not be burned out.
So just let me add to that. So I think from my perspective, a couple things. One is it's about collaboration. And I really want to recognize Surescripts as being a leader in this space and being a collaborator and a convener, so we can have PBM health plan representation together with EHRs, with physicians, to really talk about those discussions and how much data do you present, right? Particularly in the area of alternatives. Do you present 3 to 5 or do you present 50, right? And then the other thing to really think about too is what's the information that a practitioner is going to need to see 90% of the time, and then how do you enable access to that deeper information that 10% of the time where it really matters, right? And in cases like that, maybe it is a click away. Maybe you do need to scroll, right? But you have that information that's actionable without, without making the user do an extra step. And that's how you achieve your results.
And one thing from our perspective is we're definitely aware of presenting too much data, even if it's viewed as helpful data. If it's too much, it's still not going to be helpful. So we do have options that our customers can use. This is from the Epic side, where they can configure this so that they get some fewer of these alerts, I would say. So an example would be, do you only want to see the cheaper alternatives, or do you want to see all alternatives? That's something that each healthcare organization can decide for themselves when they use Epic. And then we're also looking at settings where at the clinician level, there's some level of opting out of, you know what, this isn't for me for whatever reason, and giving that layer of control to the physicians, I think it can make a big difference too.
And I think one of the value of this alliance and working collaboratively is to learn from this, right? We can learn across vendors, across pharmacy benefit managers, sort of what are the most effective ways to help the physician and patient make these decisions based on a lot of data. Mm-hmm. So we're learning, but I think the feedback so far has been good, and it'll keep getting better.
Hi, question for the panel. So this morning, Governor Leavitt mentioned the Karen Alliance and how they're working on opening up data for patients. So we're actually running a new work group to look at offering real-time benefit check for patients. So I'm curious to hear from the panel if you, first of all, think it's a good idea, and second of all, if you do, if there's any kind of hurdles or obstacles you see about opening this up to the patient.
Well, I'll say as the one person I think up here who actually has a direct-to-patient connection. So I'll say from Express Scripts, we've offered real-time benefit check for patients for many, many years. So we have a patient mobile app where they can do essentially the same exact thing that we're doing for physicians in the EMR. And we're leveraging a lot of the technology that we've been putting into our member website and our mobile app for many years. So we're fully supportive. We've been doing it for many years, and it's, I'd say we're happy that we're finally here doing that same capability for the docs. With consumerism, it's going to be both of them making that decision. So, I think having it in the hands of the patients is equally, if not more important than for the physicians.
And I'd add, the only wrinkle there is if they could search for any medication, they may not know if that medication was effective or not. But let's say they're trying to refill their medication and they find a pharmacy that might be cheaper. I think that's great. That way they can find the lowest cost pharmacy, 30 days, 90 days. If they could do all of that in the patient portal and then just tell me where they want me to send it, that would be the ideal scenario.
I think just to briefly echo, we're very supportive as well as having the patient information in our patient-facing applications. I think one area where it really can benefit is as prescription prices change over time, it can be really powerful if patients know that a medication that was affordable 6 months or a year ago now is not as cost effective, and then they can have that conversation with their physicians when they go in for their checkup. So I think having that information ahead of time is really powerful as well.
Great. I'll just say Surescripts is a member of the Karen Alliance. We're very interested in helping improve interoperability. So we'll see how it's an important area right now. So we have time for one last question.
Sure, thank you. Can you guys hear me okay? I think we're seeing some trends in legislation that are appearing to protect that point of sale discount to patient what I think has traditionally been missing from some of these services in the EHR that are showing prices to doctors is they're not including necessarily manufacturer support for patients. Are there plans to include some of those things in these services moving forward so the physicians are seeing a manufacturer direct-to-patient savings as well?
I can take that. Certainly, sometimes when we prescribe medications, if the insurance doesn't cover it, there are patient assistance programs that maybe are sponsored by the manufacturers. These things are just as onerous to fill out as a prior authorization form. And so anything that we can do to reduce work for the practice through engaging the patient and the physician, whether that's in a kiosk or a patient portal, is central to improving practice efficiency and outcomes for the patient. So we were very open to all types of patient assistance delivery so that they get the drug that they need.
And just speaking from an Allscripts standpoint, we are very much committed to creating price transparency, creating that visibility to patient affordability options, right? And welcome as much information as possible into the conversation between the physician and patient.
I'll just say we're continuing to explore other areas to improve some of the other topics we talked about. So our time is up. So I want to thank my panelists for their discussion and answers. That's great and informative, so thank you very much.
Thank you.